Good morning, 6:30, October 30th. Happy Halloween to everybody. Today's weather is looking pretty wintry. They're calling for a wintry mix, especially in the higher elevations in the southern part of the state currently. So slick conditions on the roadway, so take your time, drive safe. Remember good following distances, so you have ample time to stop if the road conditions are slick out there. So safe driving due to the weather, and also prepare for the weather. Rain gear, winter gloves. We're going through a lot of them in the tool crib, and Alberta's doing her best to maintain a good stockpile. So be patient if we don't currently have them, but they are en route hopefully soon. With that said, latest and greatest on coronavirus. You can see this is the updated map that was on Tuesday. Pretty much the whole state of New Hampshire turned a kind of quote unquote restricted travel, means that we would need to quarantine for leisurely travel. Again, this is not work related, this is leisurely travel on weekends or taking a vacation, things like that. So there's not many counties left that are quarantine free. As you can see, this kind of the second wave of the virus is kind of at our doorstep now. So we need to really make sure we're following best practices, good social distancing, good personal hygiene, utilizing the PPE, wearing a facial covering when in the presence of others. And again, the most important thing is staying home when you're sick and communicating with health and safety. Any questions or concerns, anything COVID related, we're here to help guide you in the right direction or help answer any questions that we might know off the top of our head. The latest dashboard, as you can see here, they did a big upgrade this past week of this new dashboard for us now. As you can actually has it breaking down in hospitalizations and individuals in the ICU. Herein, yesterday we had 16 new cases, and then in the last 7-day average, we're up about 0.5%. So this is kind of a different way of tracking, but you can see here's the per county in the last 14 days, we've had 94 people test positive in Chittenden County, 40 in Washington, 8 in Rutland County. This is majority where our work is being performed now, but again, you know, in the Bennington, Brattleboro area, you're starting to see a little uptick there as well. So again, it's here. It's here for a while, so we've got to just not get fatigued, keep up with the best practices, and continue to do our part to prevent the spread. So this week's code of conduct is to respect the property of others. It's very important. Best way to think about this is treat other people's property the way that you would want someone to treat yours. If they're on it, utilizing it, or working near it, again, that's just be really respectful with other people's equipment. If we're renting, other people's utilities when we're digging and excavating or drilling near them, and again on and landowners as well out there in the public right away. So nice job this week, another 7 days without a recordable injury. We did have one kind of light tissue issue that we're still kind of waiting on results for, due to kind of overstrenuing, you know, maybe lifting, pulling something a little too heavy, and so utilizing a different tool like a bar or a shovel to help prop something up for us. So it's again, it's important to utilize those JHAs to follow best practices when it comes to risk assessment and identifying our hazards and utilizing proper controls to mitigate our exposure, so we don't put ourselves in harm's way. So continue our best practices. We're doing an excellent job in the JHA, so let's keep that up. I'm going to pass it over to Amy. Amy's back with PT 360 for a wellness series. I think she's going to have a conclusion on lower back pain. So Amy, I'm going to make you the presenter, and please take it away. Amy, oh, sorry, I have you muted. There you go.
There you go.
We can hear you now.
Perfect, thank you. All right, let's change over to the slideshow here. All right, so this is the conclusion of our low back pain series. If you guys remember this chart from the last two talks I did on this, we are going to talk about this big center group of non-specific low back pain today, which is about 90% of back pain. So what non-specific low back pain is back pain without a specific tissue damage. So what we're saying with this is it's not that something's not wrong with you, that it's not all in your head, that we just can't actually pinpoint what specific tissue is damaged. Is it a muscle? Is it a nerve? Is it ligaments? Is it your joint? So if we look at this picture again, we talked about a lot of moving parts specifically in your back. And there's layers and layers of different types of tissue on top of each other. So we have really tiny joints with really tiny ligaments connecting those two, really big ligaments connecting all of your spine, little muscles on top, followed by bigger muscles on top. So sometimes when we do repetitive movements in particular, whether it's shoveling where you arch your back and twist over and over and over again, or you are holding heavy machinery that has a lot of vibration and you're using your core muscles a lot and you start to get a little lax about that because you've been doing it for 8 or 9 hours, we can't really tell what tissue is injured because a lot of them have a very similar response. But what we're saying with that is there's most likely an inflammatory component. So you maybe strained a tissue, that there's inflammation in a number of tissues around there, and we can't just specify it. So that's what we're talking about with non-specific low back pain. So here's a case example for you guys and girls. You were carrying and hauling pieces of rebar all day. This is something you've done before. Maybe you've done it for years. Maybe you've been doing it all week. All of a sudden, your back starts to hurt. You can't stand up straight. You're sitting there with your hand on your back, and you can't straighten up at all. All of a sudden, you get this aching in your butt and in the back of your leg as well. So I'm sure many of you guys can relate to this. What goes through your head next? In a minute or two time span, many of these thoughts will probably go through your head. Oh no, what if I just threw my back out? Will I need surgery for this? What if this pain never goes away? How long will I be out of work for? And will they believe me that I hurt my back? And I'm sure many of you guys have heard this from your partners, from work, from unfortunately a doctor's office is, oh, I just said I hurt my back, will someone believe me? So then what happens? You can't sleep for a few days because your back hurts. You can't find a good position. You might sleep for an hour or two. So now you're getting really tired. You go to the doctor and they say you're fine, even though you know you're not. And that's probably one of the most annoying things I hear about back pain is the doc said I was fine. I'm in severe pain. It's 9 out of 10 pain. I'm not fine. You're told to take Advil. In the past, you were given some stronger pain meds and you know they worked, but now you get Advil. And then you're told you can't go to work because you can't lift anything. So now what do? So what this all equates to, all this, you threw your back out, your back's kind of seized up, it hurts a lot. You've gone to the doctor, you're in a lot of pain. This leads to a lot of sleep deprivation, a lot of fatigue, stress and anxiety, and fear. And all of these things, whether it's just one of them or all of them or one's worse than the other, feed and worsen your pain. So I just really want you to think about that component. So if, say, everything's perfect except for your back, you might be at a 6 out of 10 pain. You add these different layers in, it might drive your pain up to 9 out of 10. So here's my note on treating back pain that I want everyone to really consider. Targeting the modifiable beliefs and behaviors that drive pain and disability may be more effective than simply treating the symptoms of pain in order to achieve long-term changes, especially where low back pain is persistent and or recurrent. So it's pretty easy for us to give you ibuprofen. It's pretty easy for us to say, hey, do physical therapy. We're going to do a little bit of massage. We're going to do a little bit of strengthening. Well, your back pain might persist, but that's okay. If we actually take a look at all of those factors I had just talked about, the sleep deprivation, the fatigue, the stress and anxiety, the fear, lifestyle factors, that's where we really target low back pain, especially persistent low back pain. So I know, you guys are a bunch of big, strong construction workers. Talking about fear and anxiety and those things that may be associated with pain isn't the first thing on your list, but it's something to keep in the back of your mind that you could kind of manage yourself a lot of the time. If you get this severe back pain that's really causing you to not be able to do a lot. So here's our phases of healing in back pain. So in the short term is your first 48 to 72 hours. If in the past, if you've had this, the doctor probably said, hey, go home, lay down for a couple days, you'll be better. We don't really do that anymore. What we want you to do is stay moving. So number one is stay comfortable. Whatever position is of comfort for you. It might be sitting in a slouch position. It might be laying flat on your back. It might be getting up and moving as much as possible. So find what's comfortable and use that position as much as you can. Get up and move as much as you can, even if it's taking trips to the kitchen once an hour, going out for a little walk. Those things might be really helpful. Pain management with NSAIDs. NSAIDs are just anti-inflammatories. So that's your Advil, your ibuprofen, your Aleve. Doctors will usually prescribe a stronger one, but those can be really helpful. Again, we're thinking this is an inflammatory issue, so the anti-inflammatories can be really helpful early on to manage some of the stronger pain. Gentle movement, and if you're doing physical therapy or chiropractic, gentle massage can be quite helpful in this first phase. Next, this 3-day period, so the 1 to 3 weeks, depending on how bad your back pain is, you might still be dealing with it. So at this phase, you want to start transitioning back to normal movements. Normal movements means when you go to tie your shoes, you don't brace your back and arch your back in funny ways to try to get around the pain. You're just trying to bend over normally. When you're going to put dishes away in your house, again, not guarding or bracing your back when you arch it back to reach up to a cabinet. Picking up light things, maybe like a laundry basket normally. So those are normal daily movements that you want to get back to and try to avoid that bracing of your spine. Trying to get back to regular daily activities and some light work activities. So again, if you sit all day at work, and the overuse issue is a sitting issue, you might go back to work for a couple hours and doing this at a sit-stand desk. You might go back to work doing some light duty activity versus jumping right back into some heavy lifting. And for some people, pain will be gone during this period. And for some people, it's going to last a little bit longer. So if you end up into that greater than 3 weeks period, you're most likely going to need some sort of PT for some strength and conditioning and getting you back to recreational activities and your heavy lifting. It's really important in this last phase, whether you hit this phase at 1 week or hit this phase at 3 to 6 weeks, that you ease back into some of the heavier type of activities that you do, whether that's pounding and running, whether that's heavy machine work, whether that's a lot of sitting. Those things that are repetitive and heavy are the biggest problems. And if you jump back into that too fast, that could lead you to chronic back pain. So persistent and recurring back pain. So this is the back pain that's really not gone away after 6 to 8 weeks. That's still hanging there. It's still hanging there at a high level. This is about 10 to 15% of people. In the literature, I'd probably say it's a little bit more. So there are some risk factors for people having persistent back pain that just doesn't go away, and it's not the specific low back pain that we talked about a couple weeks ago. So this would be called maladaptive movement patterns. So this is the bracing I've been talking about, excuse me, where when you start to move, you think, oh, I'm going to have pain. When you just think of, oh, I'm going to have pain, you actually change how you're moving. And that's something we want to avoid doing. Psychological factors that we have talked about, some fear, anxiety, poor coping mechanisms, and stress. And lifestyle factors, sleep deficiency and fatigue. So if you're one of those people that stays up all night, binge watching movies, you get up early and then you're doing a 10 or 15 hour day of work, you're chronically sleep deprived. That can actually contribute to your pain. So what do we do to treat this? We really want to treat the underlying factors, all of these factors, the movement patterns, the strength issues, the psychological factors, and the lifestyle factors. And then for the PT perspective, we touch on these, but what we really do is really address the faulty movement patterns and the strength and conditioning components. So here's just some really easy movement pattern corrections based on how you're guarding. So if you look at this top row of pictures, these are faulty movement patterns where you're sitting with your back rounded, and that position might be contributing to your pain. Maybe you've adopted this movement pattern because at first it relieved your pain, which was great, but that persisted, and now it's contributing to your pain. So if you look at the bottom picture, sitting a little upright. Again, you're not military position, chest out, butt out, but you're just gently upright. The second picture with squatting and reaching down for something. Again, if you could see the subtle nuance in the top picture, the gentleman's back is rounded at the bottom, where the bottom picture, his back is a little flatter. That's a better way to load your spine. Same thing with the next picture where he's reaching straight down. Again, when we're doing daily activities, you should really be able to reach straight down to your toes, put your socks on in a normal fashion, like the picture on the bottom. The picture on the top, the guy's hyperextending his knees, locking out his spine. That's not loading your spine properly. And the last one I'll talk about is the loaded squatting picture, where again, this gentleman's butt is tucked under and his back is rounded. That's not loading your spine properly. We're having a flatter back, again, not arch spine, but flatter back can be helpful. So if you look at these and think, hey, do I do any of these, and are they maybe contributing to my back pain? There's some really simple adjustments that you can make on your own to go back to a more normal movement pattern. And what I always tell people is don't be fearful of, oh, it may hurt. It's already hurting. So let's try to get out of that with some normal movement. This is the opposite of what we just saw. So in the last group of pictures, the person was rounding their spine to correct their back. And then these pictures, the person is arching their spine to kind of brace their back. So we're going to try to flatten their back out. And if you look, both pictures on the bottom row should be fairly similar looking, where it's a flatter back position, almost thinking it's less work to hold that position. So in the top picture, this woman is arching her spine when she's sitting. So say maybe you're at a desk a lot, and this is the position you tend to go to. It's just this arch spine position. In the bottom picture, she has a flatter back. If you go, let's see, 4 pictures in where she's bending forward. Again, we saw in the last picture, the person was rounding their spine. Now she's overarching her spine. And at the bottom picture, she's rounding it normally and just reaching down normally. The last picture we'll talk about is the picking up a box, which is something you guys probably do quite a bit, is picking up something heavy. Again, she's overarching her back to do this, which does not load her back properly, versus a flat back position and a little bit of a rounded upper spine. That's an okay position. You're going to load your back a lot better doing that. So again, these are some little corrections that if you have some chronic back pain, you're probably bracing your back in a way that you don't even realize that's contributing to your pain, and just having some more normal movement patterns can go quite a long way. So our take-home message: most of back pain is nonspecific. It's most likely not related to damage. It's more likely related to localized inflammation through a number of tissues. Stay comfortable in moving early on. Don't do the bed rest, and try to find those comfy positions. Normalize movement patterns and avoid that guarding and bracing of our spine. Start returning to your regular activity and work as soon as you can move normally. So that normal movement is really key to getting back to normal life. And address other factors that may be prolonging your pain, which is really key with the chronic low back pain. Thank you.
Thank you, Amy. And it's a good reminder, if any lower back aches or ailments that anyone has, Amy can help us get those remedied, or any other issues, knees, shoulders, ankles, things in that matter. Just let health and safety know, and we can get you scheduled for a free injury screen over at PT360. All right, Ken, I'll pass it on to you.
Okay, thank you, Amy. That was very informative.
You're welcome.
Okay, I'm going to put my screen onto the email of the week.
Looks good, Ken.
And all set?
Yep.
Okay. So for announcements this week, we have just a reminder that it's daylight savings time that starts Sunday or Sunday morning, early Sunday morning. And so at Saturday night, we should set our clocks back by 1 hour. Remember, fall back in the fall, spring ahead in the spring. So cold weather is not just around the corner, but it's essentially here. It looks like it's well below freezing this morning. So make sure we're treating our fuel and winterizing pumps. This is the final week of October, which is Breast Cancer Awareness Month, and I left on the UVM Medical Center Breast Healthcare Center website, which has a lot of good information. I've looked at a few different sites like American Cancer Society and everything, but I think the UVM healthcare site has everything you could expect to look for. So then we have the COVID policies, which haven't really changed much lately, but it's here for your use if you need to refer to it. And for this week, we are profiling the Lower Mountain View Road, I should have said, culvert replacement in Colchester, and that's down by Costco. So we are contracted, or we're contracted, we just finished the work with the town of Colchester to replace an existing deteriorated corrugated metal pipe on Lower Mountain View Road near Costco. The work was performed at night to allow for a road closure and was open to traffic by 8 a.m. The replacement pipes consisted of two 100-foot long parallel runs of 15-inch diameter SDR 35 PVC storm pipe and installation of a precast headwall outlet and inlet, and outlet end structures or end fixtures. So here we have the road closure going on, well lit up, and starting excavation. And then here we are backfilling the twin pipes. A little more backfilling, get the end sections on. And there's the head wall, like the day after it was done. There's a precast head wall. Patch on the road. And here just yesterday, I believe, kind of during the rain, it shows that maybe they should have gone with bigger pipes or more of them, because it looks like they're right up to the top there. There we go, looking back towards looks like the hotel over there. And for the archives, from the archives, we have this project handling a big piece of looks like some kind of metal pipe, luminized or something like that. We were using it for a casing to install a transmission line foundation down in Bells Falls around 2008. So that's what I got. I'll turn it back over to Matt. Everybody have a safe day and a good weekend, and good luck if you're out in the woods hunting this weekend. It is the early season muzzle loading.
Thanks, Ken. Be safe today. Have a good day.